You might know it as Molly, Mandy, or ecstasy. It's all the same thing. It's MDMA, a psychedelic drug. In the US, there's a heated debate over whether it should be legalized to help treat post-traumatic stress disorder or PTSD. In 2023, Australia became the first country to approve the use of MDMA in therapy, and US war veterans are among those pushing for their country to follow suit. But there is a lot of pushback, in part because of MDMA's notorious reputation as a party drug. A panel of scientists recently voted against legalizing MDMA-assisted treatment, citing concerns over flawed trials. So how valid are these concerns, and how does psychedelic treatment even work? Let's find out. MDMA-assisted psychotherapy uses MDMA as a catalyst to make therapy more effective. Scientists say MDMA makes patients more open to painful memories.
It likely does that at the level of the amygdala, which is this region in your brain that is important for fear processing and the storage of fear-related memories.
Jennifer Mitchell is a professor at the University of California, San Francisco, and the lead author of this paper in Nature, a highly reputed science journal.
What individuals note is that they're able to revisit a trauma without feeling overwhelmed by that trauma, without feeling that they need to dissociate or recoil or feeling automatically shamed, without dissociating and detaching. And so you actually have to sort of stay with that emotionally laden event as you process it in order to release it.
Mitchell's phase 3 study is also the meat of ongoing deliberations within the Food and Drug Administration. It shows that 71% of the patients treated with MDMA-assisted psychotherapy benefit so greatly that they no longer test positive for PTSD, and the effects can last for several months.
When you look at these subgroups that have historically been particularly difficult to treat, that have sort of a more intractable form of PTSD, remarkably, MDMA seems to work equally well in those subgroups. So childhood trauma, multiple traumas, military trauma.
In the trial, scientists provided a strong dose of MDMA under highly regulated conditions. Patients then went through intense therapy sessions with 2 therapists present. Other therapy sessions, before and after the use of MDMA, were designed to help patients prepare for the experience and later make sense of it. Many who've been through the treatment say it saved their life, or that they finally feel normal again after years and years of suffering. Some of the loudest voices advocating for MDMA are from the community of America's war veterans. PTSD is well documented in people who serve in the military, and while not every veteran's experience will lead to PTSD, it is far more common if they were deployed to war zones. Like Juliana Mercer, who served 16 years with the Marine Corps in countries like Iraq and Afghanistan. She was helping keep civilians safe and dealing with injured Marines returning from the battlefield.
So Marines that were coming back with all different types of injuries, whether it was missing multiple limbs to brain injuries to post-traumatic stress. So, years later, I realized that I was collecting their trauma in addition to my own trauma from both Iraq and Afghanistan. And that's where, almost 18 years later from when I became a Marine, I noticed that I wasn't okay.
Many who aren't okay end up taking their lives. Studies show that more US veterans have died from suicide since 9/11 than in active duty. Mercer says the help available to them, mostly antidepressants, is not working.
I know veterans that are on over 16, sometimes 20 different cocktails of medications, whether it's from the VA or from their primary care doctors. And these medications, you're getting one medication that has side effects and you're getting another medication to diminish the side effects of the other one. And it's just compiling all of these different problems and not really getting to the root cause.
But then someone introduced Mercer to psychedelic-assisted therapy. Her therapy involved psilocybin, a different psychedelic. She went to Latin America to access the treatment where it's legal in some countries.
It allowed me to just completely shed that 20 years of collected trauma and grief. And I was free from it. And I knew that that was the solution that I'd been looking for.
Since then, Mercer has been advocating to legalize MDMA as medicine. The Food and Drug Administration, or FDA, is the American authority that can do that. It's responsible for protecting public health by controlling which drugs, food products, and cosmetics, among other things, are made available to people. When the FDA held a recent public hearing on MDMA-assisted psychotherapy, many war veterans spoke about how psychedelic treatments had changed their lives, that it saved them when they were about to give up. If approved, the new treatment wouldn't just help them. It would be an option for people suffering from PTSD due to sexual assault, domestic violence, racial trauma, or childhood trauma. Anything that has caused a moderate to severe form of PTSD. Now here's the catch. In spite of these moving accounts, the FDA's advisory committee voted overwhelmingly against legalizing MDMA for the treatment of PTSD. Some of the criticism against the phase 3 trials was that the design was flawed, that it lacked data on some parameters, and that the therapy model was unclear. One researcher from the National Center for PTSD called it a black box. There were also concerns that there may have been pressure on participants to not report adverse effects, that some patients experienced side effects on cardiovascular health, and around the big question of what do we do with the few patients who don't benefit from the treatment and actually finish worse off. The scientists behind the trial find many of these criticisms unfair, but the hearing was also rocked by allegations of misconduct. Some that occurred several years back in phase 2 trials. One case in particular involved therapists breaching boundaries with a vulnerable patient. Megan, a woman who was in a previous phase 2 trial, sent in a statement saying she was blindfolded, gagged, and caressed in a therapy session without her consent.
Well, I think it's a tragedy what happened to Megan. It should never have happened. First off, we fired those therapists.
Rick Doblin is a pioneer in the field of psychedelic research. He also sits on the board of Lykos Therapeutics, the company running and funding these trials.
That story was very influential, I think, in as well as these stories of misconduct and hiding of adverse events. But the FDA is doing its own thorough investigation of all of that.
The patient said Lykos has skirted responsibility for her assault and that she left the treatment with new PTSD. Others who spoke at the hearing said the MDMA-assisted treatment had saved them when nothing else would.
Nothing has moved the needle in the right direction, and we're dying, and we need this medication.
The FDA will make a decision in August, and it is not legally bound to do as the advisory committee has said, although it often does.
We'll just keep going because we believe the stories of the patients that have been helped. And no treatment works for everybody. We're not trying to say it's a panacea, it's a magic pill. We're not saying that it works for everybody, but I do believe that it will be approved. Yeah.